Top 10 common sports injuries. Introduction to the module. This module covers information about the top 10 common sports injuries. You will also know about the diagnosis, treatment and prevention of said sports injuries. Topics to be covered. Top 10 common sports injuries. Abrasions. Ankle sprain. Hamstring injury. Groin strain. Shin splints. Low back pain. Shoulder dislocation. Achilles tendonitis. Concussion. Tennis elbow. Diagnosis of top 10 common sports injuries. Prevention of top 10 common sports injuries. Treatment of top 10 common sports injuries. Top 10 common sports injuries. Abrasions. Abrasions are common sports injuries that occur when an athlete falls and/or slides against a hard surface, such as pavement, which causes layers of skin to peel away. Cyclists commonly call this road rash since it commonly occurs from wrecking a bike on concrete or pavement. Ankle sprain. The ligaments around the ankle are strong bands of tissue. When the ligaments that protect the ankle joint are strained or broken, an ankle sprain occurs. They surround the ankle, both outside the bones, in between the bones, and inside the 3 bones that make up the ankle. Hamstring injury. The name hamstrings is derived from the butcher's practice of hanging a pig on the back of the upper leg by this group of muscles. These muscles are frequently injured, particularly by runners and those who participate in contact sports like football. Groin strain. A strain is a stretch or tear of a muscle or tendon. The injury is commonly referred to as a pulled muscle. The muscle in the groin supports bringing the legs together. There are 2 muscles that may commonly become injured in a groin strain. Shin splints. The pain at the front of the lower leg is known as shin splints. The most common cause is inflammation of the periosteum of the tibia, which is the sheath surrounding the bone. Shin splints is an overuse injury that occurs quite commonly in runners and in other athletes who overtrain. Lower back pain. Lower back pain is one of the most common problems treated by orthopedic surgeons. 4 out of 5 adults will experience significant low back pain at some point in their life. This is especially true of athletes, who sometimes stress the lower back in ways that non-athletes do not. The lower spine is a complex structure that connects the upper body, including the chest and arms, to the lower body. Shoulder dislocation. The shoulder is the most commonly dislocated joint in the body, with nearly all of these dislocations caused by a traumatic injury. A dislocation of the shoulder joint happens when the bones making up the shoulder joint are moved apart so that the joint no longer functions. The shoulder is made up of 2 bones. The ball. The socket. Achilles tendonitis. The largest and strongest tendon in the body, the Achilles tendon gets much use and abuse, but it is not, like its Greek mythological namesake, indestructible. It can be injured by a variety of things, from inflammation to Achilles tendon rupture, and many of them referred to as Achilles tendonitis. Concussion. A condition of temporary altered mental status as a result of head trauma is known as concussion. Most mild to moderately severe traumatic injuries of the brain can be classified as a concussion, and they occur at an alarming frequency in many sports, but especially in football, hockey, and rugby. Though not always visible and sometimes seemingly minor, head injury is complex and can result in causing changes such as physical, cognitive, social, vocational. Tennis elbow. Tennis elbow, also known as lateral epicondylitis or wrist extensor tendonitis, is the name for a condition in which the bony bump at the outer side of the elbow is painful and tender due to overuse or repetitive stress. The elbow joint is made up of the bone in the upper arm, called the humerus, the bones in the lower arm, the ulna. The bony bumps at the bottom of the humerus are called epicondyles. Diagnosis of common sports injuries. Diagnosis of abrasions. A mild abrasion may be treated without seeing a doctor, but any serious abrasion should be seen by a doctor. Abrasion is identified as an injury in which layers of skin are rubbed off, including the epidermis, which is the protective outer layer of the skin, and the dermis, which is the deep inner layer of the skin that provides firmness and flexibility. Diagnosis of ankle sprain. A history of turning or rolling the ankle accompanied by sudden pain and swelling may indicate an ankle sprain. A popping sound can be heard by the patient at the time of the injury. Tenderness over the injured ligaments with bruising will be noticeable. The doctor will test the ligaments to determine if the range of motion is abnormally increased due to stretching. Diagnosis of hamstring injury. Diagnosing a hamstring injury is usually fairly straightforward since pain, loss of strength, and sometimes swelling often accompany the injury and are located at the hamstrings. Laboratory studies typically are not needed to make the diagnosis of a hamstring injury. Most often, a diagnosis can be made with history and physical examination alone. Diagnosis of groin strain. Pain or tenderness along the inner side of the thigh or in the groin area signals a possible groin strain. The athlete usually has pain when bringing the legs together and sometimes when doing knee lifts. The doctor will take a medical history to determine the possible cause of the injury and when the injury may have occurred. Diagnosis of shin splint. Patients with shin splints normally describe tenderness over the inside of the shin, lower leg pain, sometimes swelling in the lower leg, lumps and bumps over the bone, pain when the toes or foot is bent downward, and redness over the inside of the shin. If the pain is being caused by compartment syndrome, and the muscles in the compartment become swollen during exercise, they may irritate the nerves and blood vessels surrounding them and cause weakness, numbness, or coldness in the foot. Diagnosis of back pain. Low back pain is usually not severe and responds to simple treatments. They will be diagnosed on the basis of medical history and a physical examination. In cases of severe pain or pain that does not respond to conservative treatment, the doctor may request an X-ray to check for signs of arthritis or bone disease. Diagnosis of shoulder dislocation. Dislocations of the shoulder may occur forward, backward, or downward. When the shoulder dislocates, not only does the arm appear out of the position, but it also produces pain. Muscle spasms may increase the intensity of pain. The common complications of dislocated shoulder are tearing of ligaments or tendons reinforcing the joint capsule. Less commonly, nerve damage. Diagnosis of Achilles tendinitis. Achilles tendinitis is diagnosed when a patient experiences discomfort behind the ankle while running or jumping. To ensure that the Achilles is not ruptured, doctors will often ask the patient to try to rise up on the toes of the injured leg, which is difficult if the tendon is not at least partially intact. Diagnosis of concussion. Symptoms of a concussion include repetitive vomiting, unequal pupils, clear or reddish fluid draining from the nose, mouth, or ears, confused mental state or varying levels of consciousness, seizure-like activity, and the inability to wake up, coma. Diagnosis of tennis elbow. The doctor will take a complete medical history, asking about the patient's daily and recreational activities. The physical examination will focus on the elbow and arm and will include having the patient do movements that may cause pain in the outer part of the elbow. The doctor may also order X-rays of the elbow. Prevention of top 10 common sports injuries. Prevention of abrasions. Protective pads and covering skin with a layer of clothing will aid in the prevention of abrasions. It is also helpful to keep the necessary first aid supplies available when the risk of abrasion is present. That way the wound can be cleaned and treated quickly, which will aid in the healing process. Prevention of ankle sprain. To prevent sprains, athletic trainers and sports medicine professionals routinely tape and brace athletes' ankles, a practice that has been common for more than 50 years. Most ankle sprains occur when landing from a jump, with the foot in an inverted position. Prevention of hamstring strain. Sports-specific training maximizes recovery and minimizes chances for additional injury. as do stretching and strengthening exercises to maintain flexibility and an adequate hamstring to quadriceps strength ratio. It is most important that the patient not return to normal activities too soon. This can result in delayed healing or re-injury, and in more serious injuries, compartment syndrome, or decreased circulation adversely affecting the tissue, can result from an extending hematoma. Prevention of groin strain. A groin strain is best prevented by warming up properly and doing groin muscle stretching exercises prior to sports activities. This is especially important for athletes who participate in activities such as sprinting and jumping. Prevention of shin splint. Since shin pain usually occurs from overuse, be sure to return to activities gradually when recovering from shin splints. Always wear shoes with proper padding, and run on softer surfaces whenever possible. Prevention of back pain. The normal effects of aging that result in decreased bone mass, and decreased strength and elasticity of muscles and ligaments, cannot be avoided. However, the effects of aging on the low back can be slowed by regular exercise that maintains strength and flexibility in the muscles of the low back. Prevention of shoulder dislocation. Educating the patient on the importance of strength training following shoulder dislocation will help in preventing recurrence. Athletes should take care to wear protective equipment for the shoulders whenever possible and to avoid violent contact sports that put them at increased risk of hurting the shoulder. Prevention of Achilles tendinitis. Warming up before exercising and proper stretching is essential to the prevention of Achilles tendinitis. Prevention of concussion. Attention to safety, including the use of appropriate athletic gear such as bike helmets and seat belts, reduces the risk of head injury. Prevention of tennis elbow. The following are good guidelines for preventing tennis elbow. Use proper form during activities, whether they are sports or job-related. For instance, be sure the tennis stroke is correct and that the tennis racket has the proper grip size and is properly strung. Warm up before playing tennis or doing other activities that involve the elbow or arm muscles. Gently stretch the elbow and arm muscles before and after exercise. Treatment of top 10 common sports injuries. Treatment of abrasions. Conventional treatment includes cleaning the wound and applying an antibiotic ointment, followed by a dry dressing. The best approach is to clean the wound, using a syringe for increased pressure in applying a non-toxic surfactant, detergent, so that it does not become infected. Treatment of ankle sprain. Most ankle sprains can be treated conservatively by protecting the ankle from further injury, resting and icing the ankle, applying a compression wrap. A short program of rehabilitative exercises to increase strength and balance is necessary in order to prevent further sprains. In rare cases, surgery is needed to stabilize the ankle. Treatment of hamstring strain. Treatment varies with the severity of the injury. Minor strains may improve quickly so that athletes are able to perform strengthening exercises in physical therapy within a matter of a few days. Treatment of groin strain. Treatment often includes the application of ice initially for 20 to 30 minutes every 3 or 4 hours for the first 3 days following the detection of the injury. Treatment of shin splint. The first step in the treatment of shin splints is to rest from the offending activities. Ice should be helpful in the early stages to ease swelling and pain. Treatment of back pain. Most low back pain can be safely and effectively treated with a conservative approach that involves activity modification and some medication to relieve pain and help reduce the inflammation. Treatment of shoulder dislocation. Shoulder dislocations are extremely painful events. The most important treatment of a shoulder dislocation is the prompt reduction of the joint. This is a procedure in which the doctor puts the ball of the humerus back into the joint socket. Treatment of Achilles tendinitis. Achilles tendinitis can usually be treated without surgery, using rest, anti-inflammatory medications, and stretching exercises. Physical therapy and orthotics for the shoes may also be needed. Some patients, however, will require surgery. Those with severe tendinitis may need to have the degenerated portions of the tendon removed. Treatment of concussion. After the evaluation, the patient should be kept quiet. Concussion complicated by bleeding or brain damage must be treated in a hospital. Athletes must exhibit no symptoms, either at rest or with exertion, before returning to play. Treatment of tennis elbow. In most cases, conservative treatment of tennis elbow is successful. However, occasionally severe cases require surgery. Conservative treatment includes the following. Put an ice pack on the elbow for 20 to 30 minutes every 3 to 4 hours for 2 to 3 days or until the pain goes away. Massage the elbow with ice by freezing water in a styrofoam cup. Peel the top of the cup away to expose the ice and hold on to the bottom of the cup while rubbing the ice over the elbow for 5 to 10 minutes. Take anti-inflammatory medication as prescribed by the doctor. Summary. In this module, we have covered the following. Abrasions are common sports injuries that occur when an athlete collides with or slides across a hard surface, such as pavement. Low back pain is one of the most common problems treated by orthopedic surgeons. The shoulder is the most commonly dislocated joint in the body, with nearly all of these dislocations caused by a traumatic injury. A concussion is a condition of temporary altered mental status as a result of head trauma which can cause physical, cognitive, social, and vocational changes. Diagnosing a hamstring injury is usually fairly straightforward since pain, loss of strength, and sometimes swelling often accompany the injury and are located at the hamstrings.